So if you can share in the chat, what are the top 1 to 2 questions you're wrestling with related to diversity, equity, justice, and inclusion in your healthcare work? While others are writing, Gemma, do you want to share a little more?
Sure. I think it's especially in healthcare right now, there's so much focused. It's hyper focused on, the end of the pandemic, grant money, FCC grants, all this kind of free money idea that was happening that helped fund some of these movements. And now that's, pandemic's over, money's dried up. Everybody, they don't want you buying that colored sticky note, like it costs too much versus the plain yellow. It's that deep. So things like, diversity, equity, and inclusion are really, they're there because we're definitely committed to the idea, but the numbers and the impact, I feel like, is on the one hand, look what we're doing. And on the other hand, if you talk to people that work here, they're like, you gotta be kidding me. So there's such a disconnect that actually creating this DEI space and new roles and some new programs, I think in some ways has actually widened the gap. Because there's a feeling of the system is doing this and wants to pat themselves on the back and wants to say, look how great we are. And yes, we are doing some great things. And there's a ton of people that are sitting back going, okay, I've survived the fallout of the budget cuts and I'm being treated like crap and nobody cares. And a lot of that is related to different folks' diversity and levels within the system. So it's, on the one hand, you can say, well, that's all right, we just keep the fight moving forward. But on the other side, how do you engage leadership in understanding that this wasn't a fad? This is, how well we do this could be a prediction of greatness of where we really can go. And this can't become the, we don't talk about thing. Yeah, we tried that, it didn't work, we moved on. We really need it to grow roots now. And that's just frustrating because where do you go when there's so much focus on money?
Thank you. Do you want to, Erica, do you want to jump in off mute?
Sure thing. So for my particular organization, we train young adults to go into the medical field. So a challenge that we have been having is making sure the managers are on board, especially with this diversity, equity, and inclusion piece, because of the type of students that we serve. Like, how can we get them on board with having these conversations of opening diversity? What does that support look like? What does that onboarding look like for these managers as well, so that our students can thrive in this field? So it's definitely an open conversation happening on our end.
Thank you so much. Ashley?
Yeah, I think at NCCN, we work with a lot of healthcare organizations. So for us, it's how are we leaders in this space, but also not just telling everybody else what to do or supporting them in doing it, but also doing it internally in our organization. And making sure that we're integrating it throughout. So there's not just a focus on let's do it with patients or let's do it with staff or let's do it in our external work, but how do we do it in all of those spaces so that they support each other?
Thank you so much. Mike, you want to share yours? You had a few.
Yeah, I think echoing what was shared, this idea of very similar to what Gemma shared. Organizations are under so much pressure right now. They have operational issues, clinical issues, staffing issues, financial challenges. And if they haven't really thought of this as core work that everyone should be invested in and that really makes an impact on the results that they care about, and it just seems like a nice to have, then it's going to get squeezed out of the budget and the prioritization and just kind of the leadership energy. So I think that's a huge challenge, and it directly relates to, I know, a theme that we've heard a lot, through the Proximity Project, which is how do we get our senior leaders engaged in this conversation in a way that is positive and productive and not a little bit on the surface, performative, those types of things, but they're really understanding why this matters and then putting it into action in the way they choose to lead and engage with others. So definitely seeing those themes in a lot of different places.
Thank you so much. So we're going to keep it moving, but thank you for those. We'll talk about some of those, address some of those. We're not going to leave with all these answers for these here, but one and two in our conversation ground on some of the things that you were thinking about. And I believe a lot of what we've learned over the last few years, which we're going to be talking about connects to things and can be catalytic for the work that you're trying to do in your organization. Talking about the how we got here. We got here because we think about what was going on in 2020 and many years prior around just kind of racial inequities and injustice, and people pushing back against rising up, right, in a way that hasn't happened a lot of times in a long time. People that are asking questions that weren't asking questions for a while. And I, to finally introduce myself, I have done a lot of grassroots work in my career. I've started a few nonprofit organizations. I've worked to prepare Black, Latino, and low-income students for top colleges. But the first nonprofit that I founded, I started an organization that did advocacy. So we were training parents and students and community members to go to the Capitol and engage and give public comment and all of those things. So I've been kind of in the thick of those things. I've worked in cities like Camden, New Jersey, and in Wilmington, Delaware, doing empowerment work, economic development work, and worked at policy at the Delaware Department of Education. And no matter what the role that I was in, it's kind of a through line and important for me to get more proximate, to hear from the folks that are most marginalized. And so 2020 happened with the pandemic and racial justice uprisings, and people were kind of texting me because of my relationships in different places of fundraising and working with school districts and other places. And we're asking, like, well, what can we do better? And what was not happening is what we were looking at this slide, right? A lot of people were addressing, like, well, let's get people educated on certain terminology and think about their privilege, or let's figure out if we can get, Ibram Kendi, ex-Kendi, to come speak. Let's start a book club, right? They were doing all these things. I'm being a little snarky, but because that was the energy, right? Like, and they were doing all these things, and some of it was positive, some of it was knee-jerk, some of it was window dressing, but still there was a powerful moment, right, to capture people that were then asking questions and move, right, this along. And I felt that people were not dealing with this reality, the reality that we live very segregated lives. We live very segregated lives in the way, the kind of localities we live in, but it's more than just that. I did a workshop yesterday for 30+ residents of a Christiana Care hospital in Delaware, and they were in a leadership program. And I said, raise your hand if you know what kind of happened in Alabama over last weekend, right? And clearly there's a lot of things that happened in Alabama, but if in my timeline of Black community that I know, we were talking about one thing, and it was all everywhere, right? And one person maybe one, I don't know, raised their hand, right, in the room. And so it's not even just proximity to like where we live, but I was like, the information flow is there. Like, Alabama, what happened, right? Someone just yesterday in our workshop talked about a folding chair in the chat, and maybe, right, a small handful got it. But that also shows that, like, where we get our information, how we engage, right? Gemma's laughing, right, is so disparate, disconnected, And so with all of that, how do we then, right, if there's such a disconnect between people in healthcare from the marginalized communities they serve, where they where they live is different areas, where their kids go to schools, different areas. How does a DEI training that comes into your office for 1 time, 2 times, 3 times, how is this really going to move? That was my concern, given what I've experienced in my work. And so I said, well, let's do something more intensive. Let's do something that centers community voices. Let's do something that is going to push people to actually get out and do community interviews and engage in a different way. Let's turn kind of what these DEI trainings look like on their head and see what is possible. And so what we'll talk about today is what we have seen as a result of that. So we started originally the Proximity Project as a result of this, right? As a result of this reality. We started originally with, actually this month, right? So this is our anniversary. We started in 2020 with just education. And I think my Facebook post just came back up from when I announced it to people, like, who wants to do this thing? And someone from healthcare immediately was like, oh, can you do it in healthcare? I was like, maybe, but that's not where, my network. And so it's interesting now where we are that just kind of serendipitously, maybe a month later, Mike Eppiheimer, however you introduce yourself, who was just leaving kind of an executive role in the healthcare space and doing other work, leadership consulting and training, reached out and we talked and we're like, this would be amazing to do in the healthcare space. And so we did that. By January of 2021, we had our first healthcare cohort. So Mike, you want to introduce yourself as well, and then I'll jump into what we've been learning through all this.
Sure, and that was a great intro. My name is Mike Eppiheimer. I've been a healthcare executive for a number of years. I now have my own leadership development and consulting firm. And as Atanray said, we teamed up on this with a physician colleague, Dr. Roshni Gary, and some others to bring this into the healthcare space. And it's just been really powerful as a personal learning experience for me, but also to see the impact that it's had on individuals and organizations in healthcare. And it's just really encouraging to see people taking the time and getting the benefit out of this experience. So really great to be here today.
Thank you, Mike. So we kicked it off, and since inception, we've had 230 plus leaders go through our cohort. People ask me all the time when I talk about and introduce them to this, they're like, well, who's the right person for our organization? It has been I love that diversity, racially diverse, it's been diverse also in the roles, right? Because I think I always say people who are leaders, they don't have to be leaders in title, but they need to be people that could be champions of this in their work and have a desire to really go back and push this. I love to see when people come in teams, right? And what has happened. So we've had a good number of representatives in the cohort, and even looking at yesterday, people that are coming back today, Gemma and others that have been in the cohort. It's amazing to see, Melissa. Hey, it's good seeing you. It's amazing to see also just that's the vision. Someone else asked me recently, well, what's the vision? What do you want to see in a few years? And I'm like, I'm optimistic. I'm an optimist. One of my Gallup strengths is around belief, right? And I strongly believe with all the things we're going to talk about that can be frustrating, I'm big that we can really build something powerful, right? A group of people that are in different organizations. One of the people that was in our cohort, we took on a national role at a national nonprofit, for example, and we met with them recently. So this will continue to propagate, disseminate, and we can really make changes within our locus of control, even in the face of budget cuts and finance and right and racism and opposition in so many ways. So let's talk about what we're learning. Let's see how we can start to apply these in our work. And then I also obviously will take questions that you have from what we've been learning and experiencing in our work. I also know you can at any point drop affirmations, questions, wonderings in the chat. I pay attention to all of that. I've been doing Zoom since we all started doing Zoom, but I do it a lot. So I have the attention span that can look at chats and talk at the same time. So please drop it in the thing, or just raise your hand. It's a smaller group of us as well in there. Okay. So what are some things that we've learned from this work as a result of these 3 years of doing this? One, we developed this over time, because when we started the program, people were like, well, what do you mean by proximity? And I'll note this I think I'm going to give people a benefit. A lot of people ask that question in a legit way, right? What do you mean by proximity? But then I also have noticed doing this kind of work when I present places where people you're giving them the answer and they're like, it still is going over their head, right? Because there's some block, right? They're like, what do you mean? I'm like, I thought you got some picture of proximity. So I made it abundantly clear. And we started to give people this checklist of some things, right, that are not the totality of proximity, but it can give you a sense of some areas that you might not be proximate. So if you want to all take a moment, even those who've done it before, Gemma, Melissa, you can go to this link here, QR code, you can do the website. And if you're having any issues accessing it, drop in the chat. And I want you to take a minute, raise your hand when you finish, to take it. It's great. You could take it 3 months from ago, and you could also take it now. So Melissa, they would also take it before. I'd be curious to see how you feel about where things stand right now. Please raise your hand when you've gotten through the 10. Thank you. All right. We don't have as much time as usual to go and get your reflections, but I'm interested in, was there any, just one, the overall, looking at the 10 questions overall, and what you know, how you responded to those. Any reflections for you on that, or anything that was striking for you after taking the proximity quiz? All right, Beth?
Nothing overly striking, but it did make me think a little bit about some of the ones that I checked no on, as to, you know, who and where would I have that opportunity. So it kind of made me think a little bit.
Can you, is there any particular one you can share about?
So do you regularly listen to, watch, or read media sources that center on communities of color? I don't really. And so you know, it makes me think.
Yeah, thank you. And I'm gonna, and when you bring that up, and I'll say that in the subsequent slide, because I'm trying to push people, like when they think proximity, for a while when we're doing these trainings, they were like, well, I used to be this, but then the pandemic, so we can't get out as much. Or they're like, I moved from X area to this area, and I used to be when I was living in Baltimore, and now I live in the suburbs, right? And the proximity is not just about you and the person, right, being in a location, but there's information you take in and so forth. So thank you for sharing with that one.
I've taken this multiple times. I do like that my score is going up a little bit each time. But even just taking it today, I was on a call yesterday that was about like brainstorming this big project. And like, as soon as we connected today, I was like, oh, I have an idea. Like I can influence what like this is about, making sure that events that are in one of our large spaces are, you know, that there's kind of like a criteria checklist. And so I added a question just now about like, is this going to promote a minority group? And realizing that like, that's how I can bring this to light. Like nobody else who is on this group is going to be thinking of that. Yeah. So by taking some time to be like, no, like that's how I can represent and speak up for groups that may not hear it. So it just gave me an idea while I was here. So thank you.
Yeah, that's awesome to hear. And you know, I think there's a longer, I'm looking here, which questions are on here. Yeah, there's a longer list of these that we do in the program, because, and there's some that talk about that with your, you know, the authority you have with budgets and resources, and you know, what do you do with those? Because there's a lot of opportunity like that gets missed, and people don't realize like, wait, I actually can do that, right? When I plan events, when I do things, I'm very, very intentional about these things, and so it has to. Those are some things you can do. Wonderful. I'm going to move on because I want to cover some other things, but I hope this was helpful. But one of the first pieces here is we talk about, you know, it is, you know, proximity matters for, and I didn't cover that slide, but when, you know, being, when there's research, right, that when you're immersed in a particular state, you know, or if you're not immersed in a particular state, it's really hard to understand, to feel, to empathize, to connect, to predict, to explain something else, right, that's happened. And the research shows that even if you were in that state, an immersive state of pain or whatever, and then you move out of it just for 15 minutes, right, you can lose it that quickly. And so when you said, Melissa, you've taken it before, you can take it, you know, a month and the next month, and people's lives a lot of times busy, as Mike and people were saying about the healthcare system. Oh, they're busy, there's budget cuts. Oh, you know, then people go to their default. Their default is like closed in. Now, how do you get to the place where your default? Is it where you know, drop off all of your connections and engagement and your life? And how do you also build it into your lifestyle where it doesn't have to be so hard, right? So when people ask me all the time, well, I want to do these things, but I don't live in a diverse area, right? I live in this, you know, all white neighborhood. And I'm like, I'm not going to tell everyone to go move, you know, somewhere else, but you need to understand that if you live there, it's harder, right? When I lived in Camden or Quiltington, whatever else, where I eat, where I shop, where my children engage is going to be more proximate to the most marginalized communities. So that is just something you have to think about, right? And so this is a comment from one of our alums, a doctor, was talking about that after this experience, it was in her mind on a regular basis that she was engaging with patients, that she wasn't, even though the system is very hurried, that she's thinking about, as you were talking about, Melissa, right? Thinking about ways that she could be more present and connected. That she was collaborating. She shared with the social worker, for example. The social worker was like, "What happened to you? why are you working alongside me in this way?" But it has to start to kind of get embedded in your mentality and your lifestyle. And I loved hearing, for example, this part. And I give this example of how do we do this, right? How do we start to make this initiative or lifestyle? And for me, I have to continually, like as Melissa we were talking about, I have to continue to think about these opportunities. Those same 10 questions and more, I think about those in my life and my leadership. And so in this case, someone invited me it was called Pancakes in Progress. It was some special elite event, right? Invite only. Leaders, all leaders were going to come to the event. Superintendents were coming to the event. Nice panel of all top leaders, right? Suit, pancakes, right? And as soon as I got that email, that invite only, I said, I think it will help the conversation greatly if you added student and parent voices, everyday folks, in addition to the dignitaries. Happy to recommend some of those interests. Also, if I can send a student or parent leader to attend my place as an attendee, please let me know. Right? It has become, this is my thing now, right? You invite me for things, whatever else, I'm looking to bring either replace myself or bring my people along, right? And it comes with a lot of practice. And then it becomes sometimes for me, maybe that's me, a sport, because I'm kind of like, I like to see, how I can push, right? How much I can push. And I know Gemma's on here who, I know she does that in the different boards and places that she's involved in. She's pushed me into some engagements that otherwise I wouldn't have been in. So I did that, and immediately they kind of like, I don't know, and then the guy says, well, how many? He says, we can have someone. I said, how many? You got to tell me, because I'll bring a whole squad. So he's like, I can give you one slot, right? So anyway, it happened that the parent and the student, he gave me one slot and I squeezed in two, but the parent and the student were the only, right, regular schmegular folks that were in that event, And I remember the parent wrote to me, showed me, the daughter sent me recently the mom's notes, and like there was words she was like, what's this jargon? And she was writing it down, and it was funny for me to see it as a person who's been an insider to that stuff. Like, it's great when you bring that into your room, when you bring that in, it pushes you to like stop talking in this jargon, to stop making excuses and all these things that we're going to talk about. So there are things right under our noses that we can do if we start to make proximity a lifestyle, right? And so some of the things that we've talked about in the program are like really looking at the people that we serve, and what is the Venn diagram here? Like where is their intersection outside of them coming as a patient or outside of them coming as someone you're right that is hierarchically lower than you, right? Where do you have any place where you connect, right? In how, where do you live? Where do you work? Where do you get your information? Where do you socialize? And this is, what has to be assessed, similar to the proximity quiz, to be able to make progress on this, right? And these are things that you can talk about also within your teams and with your organizations, right? Like, where do the people, when you're in the tech space, for example, you're building a tech product, you're like, right, they're mapping out, right? They're figuring out the persona that they're trying to reach, and where do they get their news, where do they figure all this out, because they have to get to them. And so I think it'll be interesting to look at that in your work, and then look at it for your staff, right? And see how it could be totally different, and what does that mean for your success in your work. All right, so how do we increase proximity? You guys got some sense of some things to reflect on in those 10 questions. And here's what we've been thinking about in the cohort. How do we increase proximity? Don't make excuses. Let's start there. This is something after doing, Mike has been there through every cohort almost, right? And hearing, it's a psychologically safe space. I say this, right? I'm saying this kind of, this part is very serious. And the other part, it's a psychologically safe space, right? So I understand people coming at different levels. Some people come with a lot more knowledge and they still can grow and be pushed in different ways. So that's all there. But we will also hold you accountable and push, right? And so through the program, I've heard a lot of excuses over these years, right? Of like, well, we don't do direct service. We've had people that do research. We don't do direct service. And I'm like, I'm a former data nerd, right? I actually pushed them, and it was really, they said at the end of the program, at some point it clicked with them, and I said, they kept saying, we don't do direct service, so how do we do this? We don't do direct service. They kept using this as it was like this quagmire that they couldn't address. And I said, why are you assuming that to be given? There are a lot of very proximate researchers, proximate doctors, proximate like leaders. And when I was at the Department of Education and I was doing data, anytime I get out there, mix with the people, right? I connect, right? I was doing presentations at a cultural arts center on the weekend with the same data that I was working on during the week, right? You don't assume that because you were there. Or I've talked to insurance companies and done a training, and they're like, well, we're removed. Well, what does it look like to not be removed, right? And to not be so far disconnected from the people that you're trying to serve. We don't have direct access. We can't get out, right? Our team is not too big. We don't have capacity. All of these things can be, there are people right now that are the counterfactual to those excuses. And those are people to learn from in the community. And those are people that we bring to speak in the cohort, right? Giovanna Andrews, who runs Harper's Heart, right? Who's been a single mom, running a nonprofit organization, having a job, going to school, doing, reaching all these hard to reach parents, getting them in SIDS prevention and breastfeed, right? So she was a team of one. Now she has two people, right? Finally. And so the people who like look at you like, what? You're a big hospital system and you're saying you don't have a big enough team. I know these people, right? Who are getting laws passed, right? I know some people who just did that yesterday, right? To like all these things, and they have teams of 1 and 2 and right, all kinds of opposition and oppression that they have to go through, right? We're working on a community engagement strategy first, right? All these things that can get in the way, and I say this very directly because these are things that you might be making or you might see in your organization, and we have to do this work well. We have to start to call those out and bring people in, right? Bring them to an experience like the Proximity Project, bring speakers in. That said, Gemma has brought me to speak at different places. I'm sure other leaders that are pushing the conversation that let your leaders know it's nonsense, right? We don't have to spend a 2-year planning process before we can take action, right? So that's one thing. We've gotten very, very blunt about these, and the more we hear these excuses, we're able to myth bust. Another big piece here as we think about how do we get more proximate, right? You got to get rid of excuses, and you also have to really, really start to become students of the pain and people that understand the history and the present day dynamics that you are contributing to, that the healthcare system is contributing to, that, right? So many different levels. I notice we have some people here that are in the intersection of healthcare and education, right? Like, people have to be grounded in that, in our organizations and us as leaders, to be able to really, really start to get proximate, because it is very, very painful for folks here who've been marginalized in different ways and, right, dealt with different discrimination. It's very, very painful when people kind of act, right, like they don't see your pain. Or even so, where they try to tell you, right, they call it gaslighting, right, that it's not happening, right? You're like, is this racism? Is not racism, right? I've gotten over that at this point in my career, where I'm like, if I feel that what you're doing, right, it's making me feel uncomfortable, it doesn't feel right, I put it on you to wrestle with it, versus for me to think, right? Because that's what's happened over time. That you start to wonder, am I being too sensitive, right? And so forth. Am I being angry for nothing, right? Am I complaining? But see the pain and understand the pain. And so in the program, we look, right, at this history of harm in this space, and you have to continue to read more, right? I love when a new book comes up or something, I'm like, I can't read them fast enough, because I'm trying to understand the different pieces of this and bring it back to the cohort, but also for my own work, because it helps us be able to fight this fight. So I would say that's something else that's really important. Understanding, we've talked about in the program, harm. So in what way do you feel you or your organization's decisions, actions, culture have caused harm? What do you need to undo in your work, right? Not just what you need to do, but what is going on right now where you need to undo some things in the work. We talk about that also in the program. I'm moving quickly, because I'm going to cover some things, and also please drop your questions if you have them in the chat, because we're going to be running out of time, and I want to make sure I address your questions. So we talked about no excuses, proximity. We talked about understanding the history and the harm and the present day dynamics. Really looking at culture and default approaches. We talk about that in the program. here. Oh, my GIF is not working for some reason. So they're not dancing, but they should be dancing on the slide. They should be dancing on the slide. But really looking in the work on the way that things have been said that are professional or unprofessional, or who's allowed to speak. Right, Gemma, I bring you up a lot, but she invited me to speak somewhere, and it struck me as I was on the conference flyer at the time that I had like one of my Ghanaian shirts on, right, next to hospital CEOs. They had the suit on, and I was like, wait. And I learned later that it wasn't, you know, there was some advocacy that had to happen, like, why is this guy dressed like that, right? What does it matter, right? Apparently, the speech was wonderful when it happened, right? But that would have been such an issue. Oh, he's wearing a different culture shirt, right? But like, there's so much in our work where we have this default culture, and everyone else has to try to bend to it or assimilate or feel uncomfortable or code switch in our work, and it pushes people away. It's the anti of proximity. And so, you know, people come to the cohort, and I love that they not only learn on DEI, but they learn about how we can kind of do things differently in our work, in our team meetings, and how we manage staff, for example. So we can talk about that as we get to the end. Another one that is we've learned a lot about is, and I continue to bring new things in, or reconsidering the canon. What should be the prerequisites for the different roles, right? What should people learn to read coming to the role? I'm bringing back that group that I spoke to, 30 plus residents yesterday, and I also asked them how many have read any of these books on here. Okay, the answer is 0. And it's not a blame to them, right? But this is, where does this stuff come into their training, right? Before coming to the field, after coming to the field, it would not be in the professional. So the professional development experience with the Proximity Project is giving people exposure to learn about this group of Black men and American Sirens from Pittsburgh who did not have degrees, right? Some of them had criminal records, were pulled literally some of them off the street, right? And were able to do complex medical procedures and be able to save lives and pioneer EMT in the US, right? In the world, they were taken to international conferences, right? And so from thinking of the people here from Propel, for example, how empowering it is when I read that, because there's so many conversations about education and certification and training and who can do what. And this is like, there's just a lot of like default culture that's not true, right? About what you need to be able to do things. And the Black Panther book talks about that as well, right? Lay people doing things, right? Solving the health crisis in the community, right? When nobody wanted to talk about sickle cell, Black Panther Party was doing that. So read those books in the cohort. And that is something that we're also like, how do we get more and more people in our institutions right now? When you're doing your book clubs, right? Not just, no shade to Ibram Kendi, right? Or Robin DiAngelo, whatever, but you know, there's other things, right? People kind of just go for the faddish stuff. And these are things that can be really powerful. I'm gonna go on. Building deep and authentic relationships with the community. I heard a lot of the commentary earlier when you asked about the questions, or how do we sustain this? How do we sustain this? How do we sustain this? Particularly when there's opposition at really high levels right now, or there's budget cuts. And there's multi parts to that answer. The one thing I always say is that a lot of times the mistake people are making is they're not in partnership with the community. Because when you start to really rally the community will start to do some of the fighting for you to sustain the things in your work, right? Like I come from an advocacy background, so community organizing. So, there are ways that you can be in an organization knowing some of your limitations, and you don't have to fight all the fights when you empower the community with information, right? When you tell them right how the budget and finance work in the healthcare space, when you tell them where the bodies are buried, right? Not in a way that's breaking any confidentiality or whatever, being unprofessional, but you have to empower the community, right? I remember sitting at the Department of Ed, and I created a group with data leaders from across the state, and we would meet monthly to increase communication, to empower them. And at some point, they used my meeting to organize against the department because they were upset with something. They were like, so yeah, we're writing the letter because we don't like it. And I was like, y'all, just make sure my name is not anywhere in this, But I actually love that this was empowerment, right? I love that they never were having this meeting, and now they were using that to strengthen themselves and have collective action. And same thing in your work, right? Like the community doesn't know the things that you know. They don't know about the budget cuts. They don't know things. They don't know, and some of that also by empowering them and educating them, you also are you're not subversive. You're also an asset to the institutions you work with, because there's times when the community might be giving you grief and they don't need to, because there are legitimate considerations and challenges. And you can really have make all this better when you have deep ties and connections to the most marginalized communities, right? And you can also, when you build trust, there are times when you can bear bad news, right? When you can say, you can really be able to work in a different way. And so a lot of the conversation about sustaining this work is because people are working as automatons, right? They're just by yourself, right? And you're not doing it in partnership with the community or even within your organization. Who do you have as allies that are going to be able to move this justice, equity, diversity, and inclusion work? Final few, build proximity to the core of your work. This is from the proximity plan that one of our alums worked on. They came as a team. And so you work on a proximity plan, and they started to say, what are things that we can build in time, staff time, to be on boards and to be in the community, right? It's one of the things that's will make this work sustain is when you can build it in to the life cycle, lifeblood of the work. And that is a gap for people who are saying, how do we sustain it? When I was thinking about sustaining things when I was leaving different agencies, I tried to build it into something that had to be done regulatory, something that is just like, it's going to live on well after I'm gone. That group that I mentioned continues to live on under a different name that I mentioned with district leaders. They continue to meet well after I've been gone for the department since 2016, right? So 7 years, they're still doing it. So you can build things that are going to live well beyond you and make an impact. It does take some savvy and strategy and partnership and allies, but yes. I'm going to say a few more and then we'll take final questions, comments. Bring people in, right? So in your organization, get out, connect, build these ties with the community, but also there's some people who know how to do this, right? And they can accelerate the work for you. You should not put it all on them, right? Which is happening in organizations, but the people who can come in and they already have trust and relationships and all of that. And so part of it is building everyone's capacity to do this. Another part is really hiring those folks into the organization. And it doesn't always have, sometimes it's full-time, sometimes they're on a paid advisory board, whatever it is, but there are ways that we've learned to do that. And we've seen people after the program create task force and committees and bring the people that they did community interviews with into decision-making roles. And I love to see that. Finally, keep learning, connecting, holding accountable. That's why we do these kind of regular meetings. I love to see people that have come before come again, because this work can be, it's daunting and it can be disheartening, frustrating. And if you are not finding a community of people that are like, right, keep the power, then, you're going to like fizzle out, or you're going to flame out and so forth. So those are a few things I wanted to share that we've learned. I would love to take any questions that the folks here have or comments.
Cotton Ray, it's Gemma. Are you seeing any, it feels like there's kind of like a fall off with some of this, but are you, as somebody who's, pushing the proximity project forward, seeing that in your attendance, or are you still seeing that there's a good flow of interest?
Yeah, someone asked me, I met a national tech person who's working on diversity and some tech product, and he was asking this question as well. We haven't seen, it was, obviously we're not doing cohorts of 1,000, right? But it's still encouraging to me, right? Where you work, Christina Care, for example, even with all the budget and everything like that, has sent 20 people to the cohort last two cycles, and then 20 are coming. We just agreed for 20 more, for example. Other places, we're seeing different hospital systems and healthcare want to do this work. Others, I think someone here on this talked about training their leaders, right? So we're still seeing a lot of interest and demand in this. For sure, the 2020, like everyone calling and, everyone who did this work was booked up. That it's like the gym in January, right? It's like the gym in January to New Year's, the first 2 weeks in January, where it's like, everybody's there, everyone's like working out, and then now that was 2020. And then now it's there's still a lot of people. I'm very grumpy about a lot of things around this work that are sad and make you mad. But I also, the belief part of me and is I still see a lot of great things going on. I still see a lot of great people, and I deeply believe in people power. And I've said to different cohorts, when I see kind of over the cycle of the weeks, people in their own organizations feeling opposition or feeling frustrated, I send them things about, think about civil rights movement, think about different things in the civil rights movement and other movements. If you study social movements, you'll see that it's not always like large groups, and definitely not the beginning, And so I take comfort in that fact that 230 people who are in different leadership roles, who I'm seeing now get promoted and move things, bring this to their new organizations, right? And so those things, Gemma, for me are still inspiring. And then the part then is like, that's why we continue to do these, right? So how the people that have this new urgency or renewed urgency, what kind of tools can we continue to give people around doing this? Because I think that's where it breaks down, where they go back and they have all these things, but like, how do I technically embed this into my organization? And some of those are the gaps. Was about how do we better embed this into our overall culture, not make this something extra, but part of everything we do. That was the question that came earlier, embed this in our overall culture. And I think this is where, I would encourage you, this quiz is here, share it with some people, share it with people. You don't have to wait if you're being in the program or not, just share this with other people, because first letting people start to see and think about our proximity, because people they think about diversity or equity, inclusion, and those things are, why we started this, because people want to do it still in a disconnected way, right? They'll be in the office, they'll say these words about DEI, they'll know the terms, right? And then they go home and it's segregated, and all their friends are one way, and right. And so we believe that you can't do this authentically and well without that. So you have to start talk proximity in your organization. And proximity doesn't only mean Blacks or Latinos, right? There's so many different levels of proximity. I was sharing with the residents yesterday, I was training, that there are different times, for example, when I would be, I always thinking about this, right? There's times that I was doing a workshop or something, and I was like, okay, I wanted to have a panelist in this topic, and I wanted to have a diverse representation. I was like, wait, why is it so hard for me to think of a Latino person in finance or something like that, right? And I started to wrestle with my own connections, and right, and then I'm like, well, where are the similar? I start doing this, like, what are the who do I follow on Insta or LinkedIn, right, to start to open that up, so that I'm not like, what happens? Oh, there's just not enough Latinos in finance, right? These are the kind of things that you see happening in our workforce when people are not proximate. And so start to think about the different groups in that your organization is not connected to in a number of ways. Think about also proximity, not just to by race, for example, but also the socioeconomic status. But think about it, think about something. When I was at Department of Ed, I thought about teacher voice, right? It's not just about race, but that we would do these things, and who's missing in the conversation. So I was like, let me get out. I was like, guys, we can't sit here at we got to get out and go to classrooms and go to schools. So it's not just a race thing, a gender thing, and so forth. It's a lifestyle thinking of whose voices are left out, who's the most excluded and marginalized, and what's our connection in our organization to them. So when that question that came from Beth about the culture is first making that the thing that you wrestle with all the time. When you're doing events, as you were talking about Melissa, like who's not here, right? Who's not here? Why are they not here? Who is kind of talking about this theoretically, but who actually is from that community, right? When we're just making decisions about a given community. So I think there's a bunch of reflective questions. That's why we came up with those 10, and we have a lot more that we do in the program. But start to have just like questionings, this question in your organization will start to change that, right? Allow and be okay with the discomfort of that. And I think that's the part. And then after that, think about, well, what are the ways that we can make proximity easy? So that's what I think about a lot. That by who would I listen to? That someone said earlier that when the question about media and information sources was one that was a gap for them, right? But when I talk about what happened in Alabama or whatever other thing, I try to make sure my feed, you know, I don't have to always go out. It's kind of passive proximity, right? I built a network, relationships where things come to me, right? Certain things come to me. Someone asked in our cohort, they were running, I think they might have been leading some residency program or something. And they said, when they were in the program, they were sort of sharing everything that we were giving them, all the content to their residents, the residents like, what happened, right? And they were like, well, I'm worried though now after the program, what am I gonna do? like I'm the supplier, we were the supplier and they were out of supply. And I'm like I follow Ethiofor Walker on LinkedIn. I follow tons of different names on LinkedIn where I just get on and like, I'm educated, right? I'm educated, I'm pushed. I'm like, it becomes so easy for me. And then I'm like, I'm the guy, right? But it's not some superpower. It's, you know, I built structures around me that continue to push me and continue to let me see these different voices. So those are things that can be done within your organization to make sure that it becomes the norm, right? Versus there's like this one person that everyone taps, right? When they need some diverse experience. So I will close, if there's not another question, I will close with call to action. It's my organizer hat. Join the upcoming cohort of the Proximity Project. As Gemma asked, we're not losing steam. We have a good number already for the fall cohort, but we still have space in our fall cohort, and it's going to be really amazing. I love the diversity of organizations that are coming, and some are healthcare institutions, some are nonprofit organizations, public health, right? We have these represented in insurance, right? Health insurance. So join the cohort. It is a very, very unique experience. It's on Zoom, but it is not your average Zoom. As Melissa and Gemma can talk about, there's tears and bonding and connecting, and people say they don't want it to end after the 8 consecutive weeks of the cohort. So it's on Fridays, 8 to 10:30. The next cohort is about 2.5 hours those Fridays, and then there's reading that you have to do in between, and reflection and assignments, community interviews, but it's all worth it. We have a lot of quotes of how things have been life-changing for people. So join a cohort, tell other people in your organization to join. Introduces the people if you feel like there needs to be more conversation with people in your organization before that could happen. Make some introductions, and then share a proximity quiz. That's a good way for people to kind of get to know us in our work. So that's what we have for you today. I'm really, really glad to have met some new people and see some familiar faces as well. Any final questions for the last 2 minutes?
No, I'd say, you know what, thanks for doing this. I think, a lot of us, you take these courses or these immersion sessions, and, you do as much as you can in that time, and then it falls away and you don't stay connected. You don't hear from people. You don't know what's happening. So I think keeping this connection going is why this is successful, is that we get to stay proximate to you and to the program and see what's going on. So as we share, we're sharing current information. It's not, oh, I did this thing 3 years ago, but I have no idea what they're doing now. I know exactly what you're doing. So I appreciate you, doing these connections with alums in the community and kind of giving us updates. So thank you for that.
Wonderful, wonderful. Melissa, anything before you go? Any endorsement of your experience for those who are considering or thinking about it?
It's such a great program. I recommend it all the time to my colleagues. I just got a new manager and I told her about it, and she's going to try and do it in 2024. But yeah, I want everyone who I ever talk to do this program.
We appreciate the endorsement. So that's that. Let me know if you have any questions. You can reach out. But it was great seeing you guys, and we will stay in touch. I posted our Facebook group in the chat. If you use Facebook, we post a lot of things there as well, articles, things to discuss. So have a great day, everyone.
Thanks.
Thank you. Thank you.